Welcome to this session of Responding to Seizures. We're going to be talking now about care and comfort first aid. This is the general principles or key things that you could do regardless of seizure type. My name's Patty Osborne Schaefer, and I'm joined by Susan Welby from the Epilepsy Foundation of New England. Susan, can you start us off with some of the key points of care and comfort first aid?
Absolutely, Patty. I'd be happy to. First of all, you want to remain calm. You always want to stay with the person until the seizure is over to make sure that everything has ended in a timely fashion. You want to pay attention to the length of the seizure. And I wouldn't worry if you're not wearing a watch or have your cell phone close by at hand. What I've done for my daughter is I've actually counted the old 1,000, 2,000 counting game just to give me a thumbnail sketch of how much time is elapsing. Remaining calm is the most important, and most seizures really only last a few minutes, 2 to 3 minutes tops, but it feels a lot longer. So that's why you either want to count, and I like counting, Patty, because it keeps me calm.
That's a great point, because people get scared watching a seizure, and so if the person responding to it can remain calm, that's going to help everyone else around them. One of the other key points of this care and comfort first aid is keeping the person safe. You want to protect them from injury. So if they lose consciousness, start to fall, or have fallen already on the ground, you want to move anything away from them. If there's anything sharp, get it out of the way. If there's a table or chair, move it out of the way so that they don't hurt themselves in it. You also want to help the person be as comfortable as possible. If they're on the ground, can you turn them on their side, but maybe put something a little bit soft under their head? You don't want to, twist their head, but you want to kind of put something soft so they're not banging their head against the ground. Anything that will keep them as comfortable as possible. Now, it's important to keep onlookers away, and what I mean by that is, if I was having a seizure, I don't want to wake up and then have all these people staring at me, and if I'm confused or I might be embarrassed. But you do need some people to help. So, if the person that's there is helping, asks a couple people to stay and help, that's great. But the rest of you, you try to kind of keep out of the way, so that makes it a lot easier for the person having the seizure. And then one of the big things that a lot of people don't understand is that they try to hold the person down because they think, well, I'll protect them by holding them in place. But our key message is do not forcibly hold the person down. Don't restrain them. So if they're having some jerking movements of their body, let it happen, but just try to prevent them from injuring themselves or banging their hands. If the person's sitting, try to prevent them from falling. Stand right next to them so that they don't fall on the ground. If they're standing up and start to walk during a seizure, well, can you shut the door and let them walk in an enclosed area so that they stay safe and you're right by them? If they are walking, on the sidewalk, well, maybe you do need to hold them back. And that's a case where maybe restraining them is important so they don't walk into a street. Or if you're on a subway or train platform, you don't want someone walking and they're not aware of it and walk into harm's way. So in those scenarios, you do hold someone back for their safety. All other circumstances, try to just keep them safe, but don't restrain them unnecessarily.
That's a really good point, Patty. The next thing we want to address is not to put anything in a person's mouth when they're having a seizure. In the introduction, you mentioned that you cannot swallow your tongue during a convulsive form of seizure. So we won't put anything in the mouth because they may bite something off and perhaps choke on it, swallow it and choke on it, or it could injure their teeth, their mouth, their gums. So again, never put anything into a person's mouth. We also want to make sure that their breathing is okay. They resume normal breathing. Perhaps there's some stiffening where the person's color changes. And we want to continue to track the time through that and make sure that they return to their normal breathing during that period. And when you're timing it, that's when it's important because it's a lot shorter than you may realize. In addition, we don't administer medication. We don't give them pills or food or water during the seizure. We wait until the seizure is over for anything like that and the person is fully alert and aware. At any point, for instance, if these conditions have not been met, then it would be appropriate to call for emergency medical services.
So all of these steps we've just talked about are general principles that will work with any kind of seizures. So as a take-home message for all of the Seizure First Aid, remember these key steps. In our next sessions, we're going to talk about tailoring seizures with a variety of different circumstances that'll help us build on Seizure First Aid. For more information of epilepsy and Seizure First Aid, visit epilepsy.com.